when I decided to look for a new job, I I decided I really realized at that point in my life that I was very mission driven, and I really feel passionate about genetic testing. And there was a role at Invitae that was a women's health marketing lead, and I was like, wow. Well, this is perfect because I
Right.
was in the women's health world with fertility, and I was fortunate enough to get that role. Ended up transferring into the oncology marketing lead shortly after I got there, and that was where it was amazing. I literally woke up every day getting paid to to do what I was passionate about.
Isn't that incredible?
So, yeah, it was pretty awesome.
In your marketing career, she's a great follow on LinkedIn, by the way. We'll give you her contact information if you want to reach out to Caroline. But you wrote an article about how the voice of the customer, seeking the voice of the customer, is a superpower in business. And just kind of to tell the folks out there, we worked together at Invite, and so I saw your level of excellence firsthand. But you're very passionate about understanding the voice of customer, and now you're the lead to market a product where you have been that customer, the end receiver, the patient who receives that testing. How did that affect your perspective now sitting in the marketing and sales arm of this product, knowing that you're trying to reach those clinicians, many of which may not know about genetic testing. They may know about BRCA, they don't know about expanded testing, and the importance of your role at the time to expand awareness to get the test to the people who needed it.
That's a really interesting question, Jerome, because I think when I got there, I was really surprised at the number of clinicians who do not offer genetic testing to their cancer patients. It was mind-blowing to me, to be totally frank. Obviously, the genetic counselors get it. That's their world. But the oncologists, it's not what they were trained in, right?
Yeah,
Genetics is so recent. So unless they graduated within the past 5 years, they weren't trained on anything to 0 about genetics. And so I had to kind of like get into that mindset of, how do we communicate with oncologists without making them not trying to make them feel stupid because you're just going to make them mad.
yeah,
Don't want to ever do that, but how to communicate them with it because they do want the best for their patients, and how to present information, how to provide our sales team with information that they can go in and help to educate them in a way that is non-threatening, that is just helpful. And yeah, I mean the end user is the patient, which I totally understood that perspective, but our audience was actually the oncologists. And really understanding kind of what were the blockers for them. They want to spend time with their patients, but do they have another 10 minutes to explain genetic testing to their patients? Like all of these blockers, and trying to, one of the big goals was just to figure out ways to make this testing accessible for them, easy for their teams. And that's part of why, it went beyond just marketing. We really had to collaborate across the board because it was the sales team had to be equipped with the tools to do that and the talking points to do that. And yeah, so it was interesting. And just kind of on that note, and I think I mentioned this to you recently. I i I don't remember if I did or not, but just recently a friend of mine was diagnosed with breast cancer, and I said, please be sure that you get genetic testing. And she asked for genetic testing in her next appointment, and the doctor said, "Oh, you don't need that."
mm,
I literally almost blew a gasket. I was so mad. I was so upset that this is a doctor who has my friend's life in their hands, and they're
Yeah.
telling them that they don't need genetic testing. So I literally got online and I went and I copied the guideline and the link and I sent it to her and I said, "You bring this into your next doctor's appointment and tell them to please do genetic testing. Don't ask if they think they you need it. Tell them you need it." And that's something that I feel like is a balancing act as way beyond when I worked at Invitae, but just when I am trying to kind of coach my friends or my family and advocating for themselves. If a doctor doesn't think you need something, but you know you do, how to have that conversation and request it firmly and get what you need, even if they don't think you need it. And if they won't do it, there's patient pay prices out there. There's other doctors who find a way to do it. So